a change, a draft, or a change in the cap regulation.
How about eliminating it?
Right, I was just about to say that. I thought that's what we had decided.
Again, I'm sorry.
I thought that is what we voted on and what we had decided.
Right. So if the board decided to go forward with a change or to do away with it, that's what has already been voted for. So I think that's what we're waiting for now is clarification from town council whether we can adopt a new cap regulation, or can we, the board, just move to accept.
What's town council's role in all of this?
Right.
I think he would look at approving the format of either any of the board members' proposals.
But we don't need the approval of town council, is that correct?
We would need to have town council review it if we are going to adopt a new cap regulation to be ensure it's correctly presented.
Okay, so a draft would be submitted to town council for approval, and following the approval, it would come back to the board for discussion and a vote. Is that correct?
Correct.
Well, I mean,
that could be three different proposals. Could be yours and Charlie's.
And there's a problem I see is that if we want to edit or change the regulations, assume people want to move ahead with it, I mean, each time we'd have to show it then to a lawyer, I guess, if we're going to be editing it. So that's why I'm not quite sure in what order we should be doing this. I would think it's a final draft that it would have to be okayed by town council, I suppose, if indeed that has to take place.
There could be several steps, correct.
And there could be three different versions of it, I suppose. I mean, if Eric wants to go ahead and write something in a final form for him, and Charlie could do the same, the board would have to decide what to do in the sense of picking one or editing it, and then you send it to legal counsel. I mean, town's gonna have to pay for this, for legal services, so. It just seems a little disjointed for me. That's.
I mean, Hillary, my concern was that I'm not a lawyer, right? So I want to make sure that the verbiage that I'm presenting is written in a form that's appropriate. So, and that we're following whatever legalities there needs to be in terms of, and just to, not to pick on Eric, but Eric had mentioned sometime at some point, he was concerned that we weren't being fair across the board. So I just wanted to make sure, however the language was written so that it was legal. Or had some sort of, that the verbiage was presented the proper way.
Correct.
Yeah, I mean, I think we all have a sense of where each other stand on the issue. And I guess for me, I know where everybody stands, including myself. And part of the reason that I tried to draft a proposal was because I thought it was something that could potentially be agreed upon by the five of us. But following the last meeting, I'm not sure that that's really the case anymore. So I guess I'm sort of stepping back to see what, you know, if Deb or Charlie are going to present something. So I'm not really, I guess I don't really know where to go from here either. That's.
I think it's probably back to myself is to try to get try to push for a meeting with town council. I did not hear last week, so I can resubmit that request. Town council usually visits the town every other week. And
I guess, Bruce, my concern is that, I guess I can say this plainly. I mean, I don't think the majority of us are going to vote for Charlie or Deb's proposal. So having said that, I mean, we basically know that based on the discussion that took place at the previous meeting. So, you know, why would we jump through hoops and seek out legal advice and approach town council if we essentially know how the vote's going to go? That's kind of my concern.
I think I said the same thing at the last meeting. Like I didn't think it was necessary to go any further at that point once we had the discussion, but then we had agreed that we would look at some verbiage and we voted on it. So, I mean, I've been very clear where I stand. I want to give these folks licenses, and I can't speak more plainly than that. And if we wanted to vote today on whether or not to change the regulations, I'm fine with that too. I think, to Eric's point, we know how this is going to shake out.
And, you know, Charlie's position is that section of the tobacco, the cap should be eliminated totally and not modified as Deborah's discussing. So I guess the question to the board is, do you want to keep the regulation as is, or do you want to go forward with a potential alternative?
Well, let's vote on it. Let's vote on that question, Bruce.
That would be my question.
Certainly can. I mean, a number of things have been stated. Anyone can make a motion on it and see how the board feels about it.
I move that we keep our tobacco regulation as is.
Second to that motion, at least to get a discussion going. Doesn't mean which way you're going to vote. It just means we can get to discussion if someone will second the motion. Looks like Eric, you're seconding it? Fine. Okay. So it's the time to speak up before there's a vote about doing anything about the regulation. So here's our chance for all of us.
Eliminated. You know, all it's done is make a permit to have it more expensive and a bigger pain and keep business out of Yarmouth.
Okay.
It's no way it's going to stop people from smoking. That's a fact. You know, all it is paperwork and a pain.
Anyone else?
Did we hear from anybody at the open meeting that was not a current, well, I shouldn't say that. We heard from the prospective business owners. I guess I'm just thinking back to the 2018 public meeting and this previous public meeting. I mean, I think it's obvious that the people who currently hold tobacco sales permits would be in favor of the cap and the advanced cap that continues to reduce. Is that a concern of anybody's?
There were some people from the public and owners, retailers that were for the cap and some were for against it. But our Board of Health agenda for tonight is just discussion. It does not call for a vote. So I guess we would have to continue a vote to our next meeting because it's not.
But I just made a motion. I just made a motion
on the table, Bruce.
Yeah, but it's not on the agenda for a vote. I don't think the board can do it without an agenda item.
Well, there is an agenda item.
Right, we had a public meeting about it.
It's for discussion.
This is crazy. We're just dragging this out. Right.
I mean, Mary, I hear what you're saying, but we've been dragging it out. We've had these people come in before we.
I know.
Had this
February, back in February. I know. I understand that.
Right. So I think we should have probably acted sooner. I mean, I don't disagree with that, But I also feel like in the current situation that the world is in and our town is in, and we have people that want to bring businesses and follow our rules and regulations, I just think it's short-sighted on our part to say, okay, we won't, our goal is to have zero tobacco tobacco licenses in the town. I just don't, I think that's not realistic. And that's my opinion.
Keeping business out of Yarmouth.
We don't need that kind of business. We're taught at the RAC, they're talking about the economic benefits of the sewerage and the business development that's been pent up that can occur. And I don't think it's going to be convenience stores selling tobacco.
I'm not saying we need to have 80 in here either, but I'm saying we have two viable people that want to run businesses in our town. In one area, that Great Island has been a blight on the town for years, and somebody's willing to pretty that up. And if it's a tobacco license that's stopping it and bringing the jobs that it would bring, I just think
but that's economic, and our concern is public health.
I'm concerned about the public health, our public economic health of the town. I think that's part of it.
If we continue to drive businesses out of the town of Yarmouth, public health isn't going to matter.
Let me put it on the next Monday's agenda for a vote.
Thank you. I'll withdraw my motion.
Okay. I guess for technical reasons, okay, we'll, thank you, Mary. It's unfortunate how long this has taken. And there's obviously disagreement about a number of things here. I just discussion purposes, in the future, we need to change the format here in some way. So people who are trying to run businesses are not just left hanging there, that they really need to know, and that's our responsibility. I agree with Mary. Yes, we're here for supporting and maintaining the health of people here. And that's our primary purpose here. I understand everyone's frustration, and it comes from different directions. So this discussion, Dr. Murphy, then what has to take place between now and our next meeting?
Go ahead. I will change the this agenda
subject
for next meeting. I'll put discussion tobacco cap vote. I'll also try to get clarification from town council, but it will be on next meeting for some type of vote.
Fine, and any of the board members, we all can present something, if that's helpful for our next meeting. So just keep that in mind. I think everyone here has got different opinions, which is great. So if there's anything for discussion purposes, please just submit it early enough to Bruce, so it's in the packet. That's all I ask. Okay. Any other issues on this before we work our way down the agenda? Anyone? Eric, Deborah, Charlie, Mary, anything?
No.
Okay, let's go. Number 3 here on the agenda is out. Ooh, can we slide back up a little bit? Thank you. Outdoor events, state regulation, 150 capacity, COVID safety plan. And it looks like there's one item here, and it's the Marine Corps League, the 22 challenge for veterans suicide awareness. Bruce, maybe just can you introduce us to this?
Yes, let me move down to his application.
Great.
Scroll down. I'll give a little background, and right here, I'll introduce you, Ron Timman from the Marine Corps League that submitted the application, is present to make a presentation to the board. What I'd like to do is just give a little background first. So with that, as I understand it, I've talked to Ron on several occasions. Ron's updated his draft, so I think we can try to comply with a maximum of the governor's maximum of 150 for an outdoor event. And let me just go through it in general, then Ron can jump in and put some fine touches on it. If we go forward, if we can just scroll down a little bit. Basically, the event is, it's a challenge of doing certain exercises, whether it's jumping jacks, push-ups, and so forth, doing them in a group, a time frame of 22 minutes. And they're going to be in the parking lot down at Smuggler's Beach. So let me just scroll down to the parking lot so you get an idea how we're going to be setting this up. That's the overview of the parking lot. And then you can see where the challenge is off to the left-hand side in front of the food concession. And that area is going to be blocked off. And the people will be doing their challenge within there. If we can just scroll down to the next one, it kind of shows the 64 parking spots starting with number 13 that would be used for the people doing the challenge. And a person would be in every other space. So they would have at least probably 10 feet between them, and it would be offset for a person ahead of them. So they would have enough for, we believe, about 32 people doing a challenge. And even if they had somebody with them, either supporting them or with them, that would be 2 people within an area, and they would all have separation. They would all wear a mask at this time as they're even doing the challenge. They would be doing this for 22 minutes, so they would check in. You see a check-in table. They would have 2 people in a check-in table 6 feet apart. They have the motorcycle large trailer club that they can use as a area block for people. Then they have an information table with 2 people. And then on the back side, they have a end of event water bottle, grab bag. The grab food bag is going to have some type of like a power bar, apple, banana, or something like that the people would pick up. Then they would leave. After that group would leave over a period of time, and Ron will go over this, the next group would come in. So there'd be 3 waves of group. So at no particular point we'd have more than 150 on site because they would move off. Should people on the beach or in the parking lot want to come over to watch, there's probably a little area in front of the beach concession where they would be, because there's really a dune on the side, so they wouldn't be climbing over the dunes. I think most of the people that would come would be support people of people taking the challenge. So if I can just go back now to go over what the challenge is going to entail. I think at this point in time, why don't I turn it over to you, Ron, and you can kind of go over what each wave would be doing with their, basically within an hour per wave.
Well, thank you for taking me on and listening to this. So what we're doing for each wave here, at the beginning, we'd want to do the national anthem. You see that we have a chaplain pray, we have a speaker, Lieutenant Colonel, I believe his name's Chip Carroll, give a speech. And the idea, yes, it is a challenge, but the most important thing is trying to assist veterans, active duty reserve, anybody who might be in the area who might need help, especially right now with COVID. There's a lot of anxiety going on, there's depression. We want to make sure people have the resources and the ability to seek help. So at that information table, there's going to be like a box where people can confidentially give information. We'll have veteran service officers from the local towns, whether it's Barnstable, Yarmouth, Sandwich, wherever, be able to get in touch with them to provide assistance to them or families. I just wanted to highlight that real quick. So as you see, we have our speaker, we play taps. And then the challenge itself, it's only 22 minutes. So it goes pretty quickly after you do a warm-up, you do the challenge. It's as many rounds as possible. It's a free event, so it's not, and so we're not giving prizes. It's just really to bring awareness. do a cool down, and then again, we just tell the people, here's your resources, this is who you can contact, here's a number for you to call if you need to. And then we encourage people to grab a water and depart. And, you know, I'll be the MC, so I'd be sitting there going, okay, we need you to depart quickly. So this way the next wave can come in without any issues and people keeping a safe distance. The second and third wave, we're just doing the national anthem and the main speaker on the first wave. So on the second and third wave, it's really just a scaled down, quick talk. You see the warm up, the challenge, cool down, and again, that encourage people, grab, go, please go quickly so the next wave can come in without any issues. And then the third wave, you know, same thing as the second wave. And then, you know, once people are starting to depart, we'll break down, make sure the whole area is cleaned up, looks great, and then we depart. I hope that gives a good overview.
Yeah, no, that's a good overview. What are you expecting per the number of people per wave participating in the challenge?
Great question. So what we have is we designed it around 119, 120. That's 19 to 20 volunteers. The registration form itself would be Eventbrite, and it's 100 people max per wave. And the reason we did that, you know, you have that 100 people, so you have 32 participants doing the challenge, all spaced out, plus about 68 people, you know, all obviously the whole time telling people, please keep your space, keep your distance. And the reason we kept it that number is just in case there are people at the beach or people hear about it and they come, we have that 30-person buffer of that just in case people walking in. I would really be surprised 30 people walked in, but we want to make sure we have enough completely safety if other people walk in. So the registration form really is 100 max per wave. Bruce, does that answer your question?
So the question would be, for the people doing the challenge, you have 32 spots for those people. Yep. So it's 32 doing the challenge. If they have somebody with them standing in their little bubble, not challenging, but just counting the number of jumping jacks or whatever, that's how you're getting to, let's say, 64. So that Correct. Would be your total number of people, plus your support people of 20. So
plus anybody else who just wants to come and support.
They would stand on the outside.
Correct.
They're not in the area. That could be just people watching them.
That's correct.
So when somebody registers for this, you're registering 32 people to participate in the challenge, the physical challenge.
Yeah, and we have a spot where we call the spectator spot with a limit of 68. So that's for those supporting those who are doing the challenge and anybody who just may want to just come and support veteran suicide or get the information they need. That's the other thing. People confuse that, you know, suicide is, you have Vietnam veterans committing suicide. So a lot of that age group is not going to do a physical challenge. So we want to make sure
they might just be up by the picnic tables, up by the concessionary, just sitting there watching the event and supporting the event from there.
Right, and you see that whole section. So you got the section lined off there, 13, 26, 51, 64. So that open area between the water bottles, check-in table, the motorcycle trailer, I think I tried to convey before, maybe I didn't do it correctly, but we went down there, measured it out, and that area is big enough where you could actually fit 192 people 6 feet apart. And we're trying to keep that to like 30 to 40.
Would you be putting like chairs out for them or something in that area so they know where to, that's more of the concern, is the people inside your area watching. I mean, obviously the people over by the food concession, picnic tables all look great. You could probably get, 20, 30 people over there. But the inside area that you're talking about that we see where them like 4 cars are, I'm thinking you're probably separating people over there. I'm not sure you can get 100 over there. It looks more like 32. Maybe 20 to maybe 30 people that are just watching right there.
Yeah, I wasn't planning on chairs, but we did talk about that, and we can certainly put some out.
We can look at that. I think overall, I guess it's back to the board. Now, on your time here, this was going to be an afternoon event. If you switch it to the morning, is the time still available with the town?
As far as I know, it is.
Okay. And I know you had another part of this was going to be a 2.2 mile road race, but as of this time, road races aren't allowed. So that's on hold for this year.
Yeah, we scratched the road race once I learned that and switched to the 22-minute, as many rounds as possible AMRAP.
That's the overview, Mr. Chairman.
Thank you. Okay, board members, some questions. Obviously, the issue, it's a great cause and an event here, is us following regulations from the state that we need to maintain. That's our responsibility as the board. So members, some comments, questions?
What happens if there's bad weather? Is it a weather permitting event? Would it be canceled?
I'm a Marine. I don't cancel on bad weather.
I love
it. But I mean, if it's really bad, yeah, of course, we would, I don't have a rain date, but I would get in contact with everybody that registered and just like, we're going to have to do this possibly September and relook at it at that time. Because the following weekend's Memorial Day. And so that's
right.
Not realistic.
I love that they're going to do it in any weather. That's awesome.
And the reason we have it on tonight's agenda for the board is because they want to do it this coming May 22nd as part of the 22 challenge. So that's why we're talking about it tonight. And that would give them time to finalize the time and the date change with the town and then start their PR to gather the number of people to participate.
And if I may, the reason we chose May 22nd is at the height of veteran suicide, it was 22 veterans a day committing suicide. You may have heard that and seen various 22 challenges out there. And the reason we chose this spot is because the address is 220 South Street. So you can see we're trying to keep the whole 22. I am glad to say that veteran suicide is down to 18 per day, still too high. But the recognizable number is 22. So we're really trying to just capitalize on that.
Do you anticipate 96 people signing up for this? And what if there are more?
Well,
are you limiting it?
Great question. I do expect a total of a good 200 people overall over the 3 phases. If it does max out, it'll say maxed out this wave. Please come to the next wave.
Okay. And
on the description there, it looks like there's a second wave that ends at 11. It looks like it's 10 to 11. Third wave starts at 11 o'clock. And I was just wondering how that's going to be conducted, of having people leave and come in at the same time.
My apologies on that. It should have said 10:45 it ends, and the next wave starts at 11. So we want to make sure everybody's out of there by 10:45 so the next wave can come in at 11.
So and people do not have to.
On my registration form, I did make sure the times were for that 45 minutes.
Okay, thank you.
People do not have to indicate whether they're bringing a spectator or support person, right?
On the registration form, they do.
They do. Okay.
Yep.
I just didn't see it here. Okay.
I need to make sure we have an exact count of people coming.
Right. Okay.
How are you going to kind of enforce social distancing when people are online to get bottles of water or registration? How are you going to handle that?
Much like a supermarket does. You know, you have your X's on the ground, and you're just telling people, please keep your distance. You know, much like our day-to-day lives, restaurants and everywhere else that we're going. And I'm hoping that people are being adults as well.
Your volunteers are going to be willing to speak up and make sure people are keeping their distances.
If they don't, I'll have to fire them.
They'll lose their pay, right?
Right.
And you know, these are all Marines and veterans who really have no problem speaking out.
Okay.
And their spouses get pretty loud too.
Currently, you know, state regulations are that we all need to wear masks in public. What are you doing about providing masks when people forget theirs?
I'll be honest, I did not think about that, but we'll purchase masks and have them on hand.
Great. And what's the status for sanitary facilities there, Bruce?
Bathrooms will be open. The town will open the town bathrooms. Last I heard. If not, they'd have to bring a porta john in, but that would be a follow-up question. I know, Ron, you've already reached out to the town on that.
Yep.
Yeah, let's hope the town's going to come forward with that. Anyone else? Okay, I guess this requires a vote. Director Murphy?
Yes.
Okay, it's motion time, folks.
I move we approve the application for the use of town-owned property for this gentleman on 5/22.
Is there a second to that motion?
Second.
Okay, thank you. Eric's hand went up first, I think. Anyway, okay. So any further discussion on it? If not, all in favor of the motion, kind of raise your hand in front of your screen and say aye.
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 Yeah, Charlie mentions aye, so it's unanimous.
Okay, very good.
I don't know about the burpees though, Ron. Might have to take those off. I don't know about burpees.
Hey, you know, you can take your time. You know?
That's true. That's true.
I do hope to see you all there, though.
Sounds like a terrific event. Love what you're doing.
Thank you. Thank you very much, everyone.
Yeah, thanks for coming in. Great. Okay, thank you.
Thank you, Ron. I'll stay in touch.
Okay, let's get the. Okay, we get the agenda back up. We can see what's next here this evening. It's probably going to be COVID, would be my guess. There we go. Okay, item number 3, agenda. No, we're down to 4. Here it is. Updated coronavirus. Yes. Okay. Director Murphy, the stage is yours.
Okay, we'll go over what we have available here. Let's see. What's the one after this? Do we have a shot? Oh, okay, go back.
Yeah, no, let's see where she is.
What we have, does it go over this way a little bit? This is the county.
I got it, Bruce. I'll give you a minute to get the notes down, okay?
Yeah.
That's it.
Yeah. Let's so this is the county third wave that we can see in the blue. Ours is following at about the same. Our numbers have decreased, and it appears that we're on the downward tread, similar to what the county is showing. Okay. The report that came out last Friday, just go this down a little bit more, shows Yarmouth. Does the whole thing slide a little bit? So
which way? This way? Yeah. This way?
Yeah, there we go. Come back this way, right there. So we see Yarmouth is still in the high red category, where, matter of fact, we went up to 7.11. which was higher than last week I think we're at 6 something. So we're still seeing some high cases. You can see we're currently have 137 cases over the last 14 days. Barnstable, who had the highest positivity rate, has gone down, as you can see up the top, to 4.55. Dennis remains in the high positivity at 6.7. They were at 9, so they have come down. And the other town on the Cape besides Brewster at 3.8, and then Howard is also in the red high-risk communities right now. So we've decreased from 7 high-risk communities down to 4. Yarmouth still remains the highest of positivity rates. This is week 6, consecutive week that Yarmouth's been in the red high-risk zone.
Any thoughts on why, Bruce?
No, and I'm going to come to that in a minute.
Okay.
Nothing's jumping out right now.
Okay.
Shuffled up. We're still at no.
I just want to see if it's there for you.
Yeah, no. It seems like we're missing a few sheets here, but
Right.
the deaths are remaining the same at 34. We redid this afternoon, and I thought we had a couple extra sheets in here. So let me just see where we go, and I'll come back to answer your question, Mary. So we still stay at the 34 deaths.
All I can say is that when she scanned it,
that's
sometimes
okay.
the scanners don't take.
Okay, no, we're going to just stick with what we got then. So I still have to say, take the precautions. I know people keep hearing me say that each week, but from our contact traces, we still hear people getting COVID from either gatherings, dinner parties, birthday parties where the kids are there, or a sleepover and the parents are bringing them to birthday parties. We're still seeing positive cases come in from different homes, and family members are probably the #1 case. Currently, we have 34 active cases. We were down from the start of the third wave where we had over 100. Then we had between 70 and 80 for a few weeks, and now on the decrease, we have 38 active cases. And that's pretty much spread evenly through the villages. The sheet that we don't have in here that must have dropped out was your question, Mary, is where are these cases coming from? And it's pretty well spread from the ages over the last month of March, ages from 11 to 55 or 60 are where the cases are coming in. We're not really seeing cases in the 65 and above age group, and that could be because they've already been vaccinated. And now the younger group that we're seeing that need the vaccinations, 11 through 40 to 50 that just opened up, these people are the ones that are positive. So I think we just need to get the more vaccine to them that we see has arrived. And I think that's why we haven't seen any more deaths or outbreaks in or a cluster in a nursing home, because all those people have been vaccinated along with the majority of their staff that we're working with. Hospitalizations are down also. As of the other day, there was only 4 beds at Cape Cod Hospital with nobody in ICU. That drops down considerably from when we talked March 29th, when there was 30 beds at Cape Cod Hospital and 2 people in ICU. So the number has dropped significantly within Cape Cod Hospital since March, and even the last over the last 10 days. Okay. Some other discussion points is the pause that we have on the rentals at Grays Beach, Flax Ponds, and large gatherings. That was going to be taken up at our first meeting in May, which will be May 3rd, next Monday. And at that time, the board can consider looking at large gatherings. And I'm thinking, you know, anything maybe above, if the governor doesn't change it, maybe the board wants to look at gatherings between 130 and 150, gatherings smaller on that side, as long as they have a good COVID plan. I could review that. I think we have some weddings that will be being planned coming up between now and over the summer. I know we've had some inquiries, and I think a couple people want to come in and speak at the board's May 3rd meeting, saying they have a wedding of 150 people, and they have some precautions of wearing masks, social distancing, and so forth. So I think the board could set a little guidelines for us to work at within the health department, so they don't all have to come back to the Board of Health. I think we could work on that. They do want to have these large gatherings on town property. Grays Beach, Bass Hole Cabana, we know that's a very popular spot, but it's also a very busy spot. And this year they're going to have parking down there in attendance. So the beach fills up quickly and doesn't really leave any room for weddings and use of the cabanas, which will not be allowed during the summer to the selectmen. So we're only talking between now and summer and in the fall there. But Flax Pond's available, and that's a nice site for weddings. And I think that's something we can work with the rec department to allow that. So I think it's just a matter of looking at how we want to address that. And I think as long as they have a COVID policy that I feel comfortable with, we could go forward with. I did want to bring the 22 challenge this week, just so you get an idea of what we look at within the health department and working with an applicant on what they'll be requiring for a COVID plan. If it's outside, social distancing and mask and so forth. So we do have something in writing.
Bruce, when I rented Grays Beach a couple of times, on the venue application, it had a maximum number of participants that were allowed.
Yes.
Do all of the venues state?
And we can put that on. I mean, some of the ones at the Cabana and working, and even at Flax Pond, they can limit that based on what their staff in and what the event is.
Right.
That could be limited. Absolutely.
Okay.
I think there could be a couple large events. I think we also have Taylor Bray Farm that also has weddings over there that we could look at within the health department. So we would look at that number and then look at their COVID safety policy and make sure we feel comfortable and they understand their need for what safety precautions they need to take.
Okay.
Grays Beach under complaints. We did have a recent complaint about overcrowding at Grays Beach Cabana and Boardwalk again with great weather. 2 weeks ago, we had somebody complaining, just overcrowding down there until we get a gatehouse or gate booth there during the week. That's a concern that we had last year, along with the basketball courts, playground, and soccer fields. I have talked to both of the men's group that play on the soccer fields on Sunday. One of them is not playing anymore because rec is now using the field on Sunday. So it's something that we're keeping a close eye on, these potential gathering areas.
Are you having any signage at either of those places? Certainly Grays Beach, crowding often is after any attendant would leave. It's in the early evenings where it gets pretty crazy there at that time also. So any signage at the fields or at the beach?
I would double check again, but there has been signage. I know up at Homer's Park, there is signage posted there. There's signage posted at Sandy Pond where the softball field is and the dog park. So I know it's posted there also. But we can check on signage at the Grays Beach. We did ask for additional signage to be posted.
People
really
go there to watch the sunset, so that there's definitely going to be people, lots of people there in the evenings.
Right, so they do need signage, and that's something that we'll have to monitor, and that becomes an enforcement issue after hours.
Right.
Okay. On vaccine, I can give you an update where we sit on vaccine, and here, that's good. Next slide.
Oh, it's in the middle. I know now. It's in the middle.
And here's our slide that I wanted to see at the beginning, but we did put it in twice. So you can see the, bring it down so I can just see the top of the waves right there. Perfect. That you can see to the far left was the first wave, and then the big wave in the middle is the what we had in November, December. Then it really came right down, and we thought we were doing very good in February. Then all of a sudden it shot back up in March to April, which is the third wave, which and even though it's come down now, our third wave is still higher than our first wave, and we've had more cases go through. So, but the good news is it's going down. We feel more comfortable. Over the weekend, we only had a couple cases. So over the last 4 days, we had a couple days of 0 cases, then a 1 and a 2. So I think we're definitely moving in the right direction. I think with the more vaccine that if people wanted it, it's available now. We see that Cape Cod Hospital now is getting 6,000 doses, and they're going to be at the Melody tent this week. And I sent that notice out. There was a big article in the newspaper Saturday, Cape Cod Times, and I did send that information out to the Chamber of Commerce today, who forwarded it to their members. I also sent it out to the Restaurant Association, and I sent it over to the Council on Aging to send out to their number of people. So we're getting it out there. I have talked to several restaurants that are doing very well getting their employees vaccinated and making it available to them. So I think as we get more vaccine over the last week, in this coming week, I think is going to make a big difference to all the Cape. The vaccination eligibility status, we saw April 19th, it was opened up to everybody over 16. So we thought, obviously, the first week there was a big crowd of new people getting over there from April 5th, where people 55 and were able to get in there. And I think we've seen a lot of them take advantage of the extra vaccine that has now come to the Cape, along with going to the mega sites off Cape that people have been getting vaccinated. So hopefully that's going to pay off. What we've seen is as of April 20th from last week, how the state is providing vaccine to different counties within the state. And we can see right up top, Barnstable County has been provided almost 200,000 doses of vaccine. And so I think that's a good sign when you look at some of the other counties, population-wise. And we should be getting high because we do have the oldest age group of any county. So we should be getting that vaccine. It's been slow coming, and I think we could have maybe had a little bit more sooner, but we are getting it now. So I think that's the most important part of this chart. What we have here is hard to see, but the vaccine doses shipped by county, and we can see down on the Cape, it's hard to see, but we have 91% of the doses going out. The county is getting a good percent of it.
It's a little easier for you.
Yeah. So when we look at countywide, Barnstable County is getting more than their fair share, so that's helpful. So this next chart is getting at least 1 dose per county, and again, we can see the Cape is getting, again, for the one dose, we're at 59%, almost 60% within our county of people getting one dose, which is higher than any of the other counties within Massachusetts. So on the flip side, yes, we're getting our doses again, which we should be because we have the highest elderly population. Fully vaccinated residents by county. Again, we're doing better here over the last 10 days to 2 weeks. Again, we'll see the Cape at 41%, which is higher than all the other, any of the other counties. So the vaccine is getting here. I do have to thank our Zoom master for getting all this up and blown up and following my talk here.
You're welcome.
You're welcome. So the vaccine is coming. I mean, we're at 41%. We still have a ways to go, but I think as we saw in the last couple days, vaccine arriving on the Cape. This one will be a little bit more challenging to read. This is by age group within the county, within Barnstable County, of what percent has received the vaccination of at least one dose. And I think if we start from the right-hand side, 75 and older, 95% of that population has received one dose. And then even the age 70 to 74 is 84%. And then 65 to 69 is 84%, excuse me, is 88, 84. And then 60 to 64 is 78. So people are getting their one dose. I think where our concern is, as I mentioned earlier, was that age 20 through 50 that are just starting to get their vaccinations now. And I think that's where we're seeing a little spread. So I think with the extra vaccine that's coming out, that we noticed coming out to the hospital this week, and probably also over to the community college, we'll see those numbers increase. And then we're hoping that the percent of COVID decreases. Okay, good. That's just showing the other counties. How does that fend for Yarmouth here? We wanted to break that down a little bit. Kind of a difficult chart to read, so I don't want to spend a lot of time, but if we look kind of at the bottom two, we can see age 75, you know, we have about 3,700 people and we're vaccinated about 3,400. So with at least individuals getting one shot. So that's about 91%. So we're doing very well getting the shots out to our elderly population, and they're taking advantage of it. So we still got a ways to go, but I think it's something that we monitor this, Mary, in board members, who's getting the shots and where do we need to direct it to. So I think as more as we can reach out to the community, I think that's helping. As we kind of wind down to our last two slides, the homebound, we're doing very well. We were going to start 2 weeks ago, and the fire department had gone to pick it up to Harwich. And as they were at the door of Harwich, that's when Johnson & Johnson pulled the vaccine. So as they were standing at the door, Outer Cape Healthcare had to put that on hold as we were ready to go. What we did then is change direction with Outer Cape Healthcare and went with Moderna, and the fire department was able to go out 2 days last week. The fire department had 4 teams going out, which was great. It was challenging, but the fire department did a great job because some of the personnel was down because of school vacation, but they were able to send out teams of 2, EMS and paramedics, to give the shots and then stay there 15 minutes and if the people had any reaction. So that worked out terrific. I think we've probably done about at least 60 homebound people. All the others have been called, and we're ready to start again later this week. And this week we'll probably we're hoping to use the Johnson & Johnson one shot only. So we're hoping to get out probably twice this week. And then the fire department will go back with second doses in 3 weeks for the first group. The coordination between the fire department, Outer Cape Healthcare, and Diane Kane up at the senior center, the coordination has been terrific. The communication's been great to get that out there. There's just, so all the people have been called, so they know what frustration we had when they pulled the Johnson & Johnson, but everybody's been staying, the Council on Aging has been staying in communication with everybody. So we're trying to keep that frustration as low as we can. People that still might be homebound or things have changed. They weren't homebound 2 weeks ago, but now that they're homebound, they can still call us, the Council on Aging, at this number here, and we can add them to our homebound list. Because I know some people on homebound have come off, and we've also added some more. So that program's working very good, board members, and I can't thank enough to our fire department and our Council on Aging. So with that, that's where we are. We are seeing numbers go down, and I think we're on the, hopefully we're on the right trend. We're in constant contact with the school nurse. That's going okay. We have the kids back to school this week. We keep our fingers crossed that people coming back from vacation have all taken precautions. Right. That's my overview, Mr. Chairman and board members.
Okay, thank you. I think there's one issue I think we need to spend some time acknowledging, at least, and it's a difficult one. Numbers are going down in the state as well as here. But despite all the efforts the Board of Health and the Health Department has made, our town has one of the highest rates of positivity in the state, certainly on the Cape. And it's hard for me to put this together and to really, it's frustrating and not really having, I don't have a full understanding why that is the case, that our town, despite its effort, has almost the highest in the state, if not the highest. Just the board is aware, I had asked Bruce to contact State Department of Health and speak to, it's Dr. Brown, I think, who's the head epidemiologist. If she has any insight to why that's the case. I don't know if any of the board members have any ideas of what and why our current status is as awful as it is.
I have not heard back from Dr. Brown yet, but now I know that we're on the right trend. So I'm hoping that this week it will decrease. I mean, we've been carrying a high number, so I don't know if it'll be 2 weeks before we drop down considerably, but we're heading in the right direction right now.
Do we believe that most of the spread has taken place within the household? In other words, you know, not being spread at outdoor gatherings, rather
correct,
indoor.
Correct. We're not aware of any outdoor gatherings that's having the spread. You know, what we're seeing, it's more in a household. Obviously, you got to get it somewhere to get to the household, but they're not picking it up outdoors at the park or what we're even seeing as a restaurant or another event. But we're seeing it go back into the house, spreading within the family. One of the children going to school and then coming home. But we're not seeing any clusters at school where there might be 2 or 3 kids in a classroom. We're just seeing it, and the stats show it from the tracing, is mainly the getting through the household.
Okay, anyone else?
I know our Department of Public Health call tomorrow, Mr. Chairman, has been moved from the afternoon, the usual afternoon time of 3 o'clock to 9:30 to 10:30. Then the governor is supposed to have an announcement tomorrow, an update on some type of news on COVID status.
Yeah, that information hasn't leaked out yet, so I'm not sure what he'll be presenting. I don't know if it has to do with outside gathering, whether it's masks, I'm not sure. But
well, we do see some other New England states have eased up their precautions, whether it's New Hampshire, Rhode Island, or Connecticut. So hopefully, as these numbers come down, and especially knowing that outdoors and gatherings is not an issue, hopefully that will be something the governor mentions.
okay. As I said, I don't have the agenda in front of me or on the screen. I assume it's old new business. Is that next?
Nope, that's old new business. Our next meeting is next Monday, as I mentioned. We'll probably follow the format of tonight with the tobacco coming in and then an update on the coronavirus.
Okay. Anybody have any old new business?
We haven't been getting any minutes. Are they being transcribed or?
Yes, we do have a new secretary that just started within the office. We're very happy. She's at the meeting right now taking minutes. So we'll be able to start that. That was one, Christine just wasn't able to keep up with it with her task, but we do have our new secretary that just started, Erica Polite. Started 2 weeks ago. We're very, very happy to have her. She's a terrific person, and she'll be taking the minutes and then probably working backwards through a few others, along with our other person, Meredith, intern that we'll be picking up on a contract, and she'll be able to go back. She's been out on a medical ankle surgery. So she's going to be out several weeks, but she'll be coming back to us. So we're kind of working our way back to full staff.
I have a question. Now that I've become immersed in RAC, part of the funding for this whole project or the beginning of the project is going to come from revenues from the rentals. Is that going to affect your staffing and your ability to?
No, not at this time, no. We did ask for permanent staffing to be included in this year's budget. The selectmen did not want to include it this year. They wanted any of that money to go towards totally wastewater, but they would use for the second housing inspector COVID money for this next 1 year and then reevaluate it. Because I think you'll see an increase in the short-term rental money as we go forward.
Right. Okay.
Bruce, I haven't heard anything about substance awareness committee.
Great point. Great point. We did have that presentation about a month ago. Meredith made the presentation. We are still going on with the grant that we received from the county health department, and we're working with the students at the high school on a art design for substance awareness. We've asked working with the high school teacher, and we've also reached out to the middle school, and they'll be doing either a poster or video presentation. And then we'll be doing a display the middle of March at the Cultural Center. So in fact, that is very active, and we'll give, right now I know we have at least 3 students that are ready to go. And I talked to one of the principals last Friday, and we're hoping to get some more, but we're ready to go with the high school students and make the presentation and have a opening over at the Cultural Center.
Is there a meeting date that I should be aware of?
I will, yeah, the date at the Cultural Center, I will get that at our next meeting. It's going to be like a Friday, Thursday, Friday, Saturday special room they're going to give us for an update over there or a presentation.
Great. Anybody, anything else? The tech team did a great job. I would give them 3 days off, okay, this week. Thank you.
You know not of which you speak, sir, but thank you.
Very good. So if everyone wants to be able to shut their screen down, we need a motion to adjourn.
So move.
Is there a second there? Someone? Hey, Eric, thank you so much. Everyone in favor of the motion, just raise your hand, say aye.
Aye.
Is Charlie still there?
Charlie makes it unanimous.
That's fine. That's good. This meeting is adjourned. Thank you, everyone. Stay safe.
Have a good night.
Aye.